Okay, everybody, it's John Shin with Empower Brokerage here again with more information about more questions that come from our policyholders and from agents all across the United States about Medicare. And as with most other videos, I'd let you know that the questions and the answers usually come out of the Medicare and You booklet. This is where we go, or to Medicare.gov. In the last video, we were talking about the rights and entitlements that we all have as Medicare beneficiaries. So that all has to do with being treated respectfully and with dignity, no discrimination. All those types of things are not allowed and not permitted and strictly guarded as protections that we have. Now, what I want to talk about is if something happens to you and there's a decision that's made that you disagree with, you can actually file an appeal for that. So I want to talk just a little bit in this video about how to file that appeal. So an appeal is an action that you can take if you disagree with a coverage or payment decision by Medicare. So if you disagree with that, and that can happen, that you just disagree with it, you don't have to take that as the last word on the matter. You can file an appeal. So this is something that we actually don't see a lot of in just everyday life, but it goes on all the time, and there's a process in place for that. So I just want to make you mostly aware of this. That's the most important thing, and then you can do more research yourself here. But usually you're going to get plenty of help filing an appeal if you disagree with something, which I hope most of you know by now, that you don't have to accept that. So with this action, if you have a decision, and I'm reading straight from the booklet, for example, you appeal if Medicare or your plan denies a claim. So if they say, hey, we don't owe that, we're not going to pay anything on that, and that can happen. There are certain things that Medicare does not pay for, and or may pay a limited amount on, and you don't know that. How would you know that? But you file that you think that you've been mistreated or treated unfairly, then you definitely have the right to file an appeal on that decision. So this is a request for a healthcare service, a supply, an item, a prescription drug that you think should have been covered by Medicare and it's not. A request for payment from a healthcare service, a supply or item, or a prescription drug that you've already gotten. A request to change the amount you must pay for a healthcare service, a supply item, or prescription drug. So if any of that is not what you think it should be, then you can protest that, and then if you don't get the answer you like to that, you can actually appeal that decision and ask for a different outcome. So you can also appeal if Medicare or your plan stops providing or paying for all or part of your health care services, supplier item, prescription drug that you still think you need. So if the prescription drug insurance company or the pharmacy, they quit providing this and quit paying for it, then you can appeal that, of course. Any at-risk determinations made under drug management programs that limits access to coverage for frequently abused drugs like opioids. There's special information further into this, so we won't cover that now, but you can appeal those decisions. If you decide to file an appeal, you can ask your doctor, supplier, healthcare provider for any information that may help your case. So you're entitled for all the information that you have in your medical file by anybody that provides care to you. You can ask them for information that you can use to help your case in the appeals process. So this is just a little bit more about how that works. Hopefully none of you will ever have to have this, but it mainly is here for your information to make you aware that of the right that you have, and the rights that you have, the entitlements that you have, and then the appeals process if you think you've been treated misfairly, or if you think your case should be readdressed. So thanks a lot for watching, and we'll see you on the next video.